two things that basically stood out when I was looking at the results of our study is that the field of headache, there is a gap there. And when I say gap there, the studies that we pulled together didn't use consistent definitions of persistent headache. Many of the studies actually didn't apply standardized ICHD criteria to diagnose someone with post-stroke headache. Sometimes we also found out that some of the studies also didn't use like validated disability instruments. So it's really hard to have a concrete conclusion for these patient populations. Um, the second is that we always have to remember that headache is not just an acute warning symptom of stroke. Back in med school, we're always like taught that worst headache of my life would be like a hemorrhagic stroke or a subarachnoid hemorrhage. But that is not the case because minority or 37% of patients would also have headaches after the stroke. And we also have to think about our questioning whenever we see these patients because they can be severely impacted in their quality of life, their work, their studies can be hampered in that sense.